Today we're talking about age-related macular degeneration. It's a condition patients typically start to see that their vision is going cloudy, blurry. They may even see kind of when reading or fine detail tasks, their vision appears to be wavy, and this starts to decrease a lot of their ability to perform activities of daily living. This is a condition that typically affects, as we talked about, it's age-related, and so people over the age of 60 are more heavily impacted, and the incidence increases as time into the 70s and 80s. More than half of people are affected by the condition by the time they reach their 80s, and 2 to 3 million people in our United States population are affected by the condition. And what we typically talk to patients about when they come in and receive the diagnosis is they have macular degeneration, which appears in two forms. There is drusen that start out in the eye, and that's the early forms of the disease. And this, it's little deposits that happen on the back side of the eye where vision happens, the retina, and specifically at the macula is where our central vision is at, which is why the impact on vision is so great. The forms progress in two ways. There's the dry macular degeneration as well as the wet. And the dry form starts with these drusen deposits that increase with time. Nutrients are decreased to the retina, and so that scarring takes place and decreased visual function ensues. The wet form of the disease, there's blood vessel growth, which becomes leaky and decreases vision over time with severe scarring. And the two forms take very different treatment paths, but with the dry form, modifiable risk factors that can help prevent blindness has to do with dietary intake of green leafy vegetables, antioxidants, which is why another form of treatment for that particular condition is with supplements. You will see over-the-counter AREDs, and just participating in good exercise and dietary monitoring along with your primary care. And then with the wet form, there's injections that can reduce some of the scarring that takes place. There's a few things that can be altered so that we can prevent the progression of the disease for both forms of macular degeneration. Stopping smoking and decreasing tobacco use has a major impact on progression of the disease, and so that is something that increases the likeliness of the disease progressing by 7 times. So decreasing the tobacco intake has a great impact on it, as well as these treatment options that we discussed with wet macular degeneration, getting injections. The impact on vision, once it has taken place, there's no cure for the disease, and so preventing it from getting any worse is the major thing that clinicians try and tackle. With the blurred, wavy, and difficult to properly focus vision that's kind of resulted, and some of the forms of blindness, the best way to increase the ability to handle the dailies of activity that patients pursue is to increase the ability for them to perform these functions with reading aids, as well as different types of telescopes and reading lamps that can be available through a vision care specialist.